Welcome to Clause 8. You're watching a short clip from one of our full episodes, featuring real conversations with the leaders shaping IP.
So as you mentioned, 101, I guess, hasn't been the most pressing issues for pharmaceutical companies dealing in policy. Last administration, we saw, I guess, there's been a narrative that actually patents are the cause of high drug prices. Mm-hmm. And then we saw kind of an effort to get, the administration to put forth policies to kind of rein in patents in service of that. Mm-hmm. And there's a lot of things that the USPTO, all these proposals about thickets, making it hard to get cons, raising fees, even proposals for margin rights. I guess, can you just share your experience of navigating, I guess, the previous 4 years? Yeah.
So this is where, once again, Mark Twain comes through every time. And he's and this community, your audience knows this, but Mark Twain has like some of the best patent quotes ever, right? He's got the one about the crab, like, a country without good patent laws is like a crab that can only move sideways or backwards. But he also, and by the way, the reason, just really quick aside, the reason for that, which is really interesting, he was a patent owner himself. He has a patent on bra straps, a patent on a board game, and a patent on, there's one other one. I forgot exactly what it was. Oh, a self-adhesive scrapbook. Okay. And actually, he made more money on that self-adhesive scrapbook than any of the books that he actually wrote as an author. Just a little side note of trivia. But one of my other favorite quotes of his, which is not patent specific, is, a lie can travel halfway around the world while the truth is getting its shoes on. And that is exactly what has happened, unfortunately, with this narrative that it's all the patent system. That's why drug pricing is wrong in America. Drug pricing, which I'm not an expert on, I obviously know some of it because it's in our industry, but it's a very complicated thing. There's it's been written about that today with, PBMs, middlemen, our healthcare system, all of that.
We've seen the pharma ads.
The system, right? Pricing is pricing. Yeah. The only thing that patents do is give you an exclusivity period. They don't tell you what the price, therefore, of a drug should be during that period. So that's one way to slice that. The problem we're getting is, you have these activist groups that are perfectly, let me just be clear. I think having activist groups on any issue is good. Having different voices, expressing their opinions, that's all great. The problem is that if they're not doing it truthfully, based on accurate data that they can back up, that they're willing to share and publish and debate, then we're not really having a policy debate. We're having an ideology debate. And that is not helpful, no matter what your views. I don't think it's helpful, no matter what your views or your interests are. It's not the right way to do things. And that is what has happened. So the patent thickets, the claim for years from these groups has been that there's 30 to 50 years of exclusivity on every drug and that there's hundreds of patents on every drug. The real data that the USPTO under the last administration and this one both have confirmed, which is consistent with other studies that came from independent academics, is that the average number of patents on a drug, an Orange Book listed drug for small molecules, the big studies show it's 3 to 5, and the average in the PTO study from last year is 8.6 patents, which is a tiny number of patents, right, compared to the thousands or hundreds of thousands on high technology, things like that. This patent office said the same. Thickets are not a problem compared, they're very rare in the pharmaceutical field. In terms of the real thing that people should be asking, though, it's not the numbers of patents, right? The real question ought to be, how long is a drug actually exclusive? Because the link between drug pricing and patents, it is true that after a drug comes off patent, generics enter the market and then the prices come down because there's more competition. That's how the system is supposed to work. That's the public bargain, right? You get the patent for a limited term, which is what the Constitution says. And then the competition comes in. Everyone's free to use. And the question ought to be, how long are pharmaceuticals getting an unduly long period? Fair question, right? What is the period of a patent? 20 years. What is the period that Congress put in place under the Hatch-Waxman Act that small molecules as a minimum are supposed to get? 14 years, the bill says, Hatch-Waxman Act. That's the patent term extension system is supposed to aim to give you a minimum of 14. Okay, so what is the average period that drugs actually get before generics come in the market? It's 13 years.